Good morning, my dear students. Now we discuss about the anti-emetics. So, what is the emetics? These emetics means it's the elimination of the unbound drug from our body. And the next one, emetics means simple definition. It is vomiting occurs due to stimulation of the emetic in the medulla oblongata. So, anti-emetics means exactly quite often opponent definition of the emetics. So, means these drugs are used to prevent or suppress. These drugs are used to prevent or suppress of vomiting. Prevent and suppress of vomiting is known as anti-emetics. So anti-emetics is a classification. What are their classification? Different types of classifications are there. Number one classification is the anticholinergics. Anticholinergics. And the second classification, H1 antihistamines. H1 antihistamines. And third classification, neuroleptics. Fourth classification, prokinetic drugs. And fifth classification, 5-HT3 antagonists. 5-H3 antagonists. So anticholinergics, H1 antihistamines, neuroleptics, prokinetic drugs, 5-HT3 antagonists, and etc. So examples, what are their examples? Anticholinergic example is dicycloamine. H1 antihistamines example is the promethazine. And the neuroleptics example is the chlorpromazine. And prokinetic drugs is example is the metoclopramide. And the next one, and 5-HT3 example is 5-HT3 antagonist example is granistrone. So these are the examples. So first we discuss about them. We discuss choose any one drug from this topic. So in this topic is the anticholinergics. Example is the dicycloamine. So for example, dicycloamine is the best example. So by dicycloamine is used as a prophylaxis and motion sickness, and for the morning sickness purpose we are using. So what is the dose? So dose is a 10 to 20 mg. 10 to 20 mg is the adult dose, and the children dose is 10 mg. So this is a dose. The next one, in here, what is the mechanism of action? So mechanism of action means metoclopramide and different types of drugs are in their particular antiemetics. So in here, these are it show the D2 antagonism mechanism. So in here, it is in the emetics. It is a agonist of the dopamine. It is the antagonist of the dopamine. Means the dopamine is a inhibitory transmitter in the normally acts of the delay the gastric emptying. So in here, especially D2 action, dopamine acting through D2 receptor. So dopamine is an inhibitory transmitter in the GIT, in the GIT. It is a inhibitory transmitter in the GIT. So normal acts the delay the gastric emptying when food is present in stomach. So food is the present in stomach, it is the delay the gastric emptying normally acts. So it is also appears the cause the gastric dilation also. It is appears also gastric dilation also, and attending nausea and vomiting. So in this any disturbance occurs in the stomach, the dopamine is the inhibitory transmitter in the GIT. It leads to the vomiting or any others is occurs in the delay gastric delay. So at that condition, these drugs are against of the D2 receptors, against activity of the D2 receptors. D2 receptors is the opposite effect of the particular vomiting. And the next one, it releasing of the acetylcholine. Releasing of the acetylcholine in the stomach. However, clinical action is a secondary, and then releasing of the acetylcholine is responsible for the stopping of the vomiting. So simply dopamine is inhibitory transmitter in the GAT. That's enough. So normally acts to delay the gastric emptying when food is present in the stomach, but it also appears in cause the gastric dilation, nausea, vomiting also. At that moment, these drugs are against activity of the vomiting against activity of the dopamine. It releasing of the acetylcholine. Acetylcholine mean, what is the importance of the acetylcholine? It is a relaxant. It is a muscle relaxant. Act as a muscle relaxant. So it is releasing from our body. So it leads to the stopping of the dopamine. That is a mechanism of action. So the next one, what is the pharmacokinetic parameters? So what are the pharmacokinetic parameters? So pharmacokinetic parameters is administered through orally. Why? Because of it's more absorbed from the orally only, more absorbed from the GIT tract, and enters into the brain. The next one, distributed through body fluids and including the cerebrospinal fluid. It crosses the B3 and reaches to the brain, and as well as cross the placenta also, The next one, it is partially conjugated in liver, and the next one, metabolated is partially metabolated in the liver, The next one, metabolated in the liver and excreted as a urine, So what is the T off? T off is the 24 hours is the T off, and T90 is the 40 hours is the T90. So T off and T90. The next one, it is not only administered through orally, it administered through parenteral route also. The next one, what is the contraindications? So contraindications means it is absorbed, then it is applying on the gastric empty time. The next one, it reduces the extent of the absorption, and the next one, hypersensitivity, pregnancy, lactation. These are all of the contraindications. And the next one, reduce the bioavailability also, The next one, adverse effects. What is the adverse effects? So adverse effect is dizziness, and the next one, loose stools, and the next one, sedation, and the next one, headache, nausea. The next one, it can cause the Parkinson's disease. But emetic drugs, it is used as a anti-Parkinson's disease. It is a Parkinson's disease. It leads to the Parkinson's disease. And the next one, it should it affected on the infants, and loose motions, and etc. So this is about the adverse effects. The next one, uses. So what is the uses? It is mainly used as a anti-emetic. And the next one, anti-emetic, main especially anti-emetic, and stop the vomiting sensation, and the next one, it is a used as a radiation sickness, and less effective in the motion sickness, less effective in the motion sickness. This is the uses. And the next one, is the role of nurse. That's your homework. So if you have any doubts from this topic, tomorrow we will discuss.